Hello, this is Dr. Joe again. This video is still on alphabetic list problems, still on letter R. Today I'm going to talk about the rhinitis and the nasal diseases. Rhinitis could be isolated, just the inflammation of the nose, or could be part of upper respiratory tract infection, or could be part of systemic allergy. So this is the rhinitis. It seems so minor, but it's so common. There are different variety kind of rhinitis. Let me just bring up the first emergency situation associated with the rhinitis. If it is isolated rhinitis without systemic disease, without any problems, probably there's no emergency unless the bleeding is severe. Epistaxis cannot be stopped at home. So if that's the case, that's emergency. But usually, if the rhinitis is associated with upper respiratory tract infection or part of the upper respiratory tract infection, then that could be associated with emergency, like the high fever, particularly in children, nasal congestion very severe, fever, headache, or feel fatigue, especially if the fever cannot be brought down. So this is a part of the upper respiratory tract infection. So if in terms of emergency situation associated with the upper respiratory tract infection, I think I mentioned it before. Isolated rhinitis probably is not emergency unless the congestion is very severe. Even though that's the case, it still is not an emergency situation. Or the rhinitis may be part of the rhinosinusitis. If that's the case, the headache is severe, high fever, discharge is greenish, yellow-greenish. If that's the case, you really, even though it's not emergency, but you need to see your physician to get treated, probably indicating that rhinitis is part of bacteria-caused sinusitis. So in general, any rhinitis you manage at home, probably you do it all the time. The minor nasal congestion, drainage, part of a common cold, you probably just no fever, you do it all the time to manage at home. So let me just talk about the rhinitis. Start from nasal structure. We all know. Actually, it's quite obvious. You know it. It's small. It's the opening of the lung for the breathing, and there's some conky structure inside of the nose to turbulent the air. So just not breathe through with the speed to the lung, but with those conky structure to slow down the wind blowing into your nose and to taper it and become gentle to breathe in the air. So that's the purpose. That's the main structure, of course, in the nose. So talk about the rhinitis. Could be isolated rhinitis. The most common cause, I think, is allergy, seasonal, or the common cold. So the viral infection, part of the viral-caused upper respiratory tract infection. So if there's the allergic or allergy-caused rhinitis, usually seasonal, and in the damaged area, or the conditions not very well turbulate in the air, so like isolated, enclosed, and damp. And also seasonal, the pollen, and also the cold. So if that's the case, the rhinitis the symptoms for this kind of allergic is usually drainage of clear fluid. And so if that's the case, then particularly if you know it's seasonal, then you probably start early to prevent. Before the pollen season, start to take some medication or follow up with your physician to start prevention. And also some of the rhinitis, if it's part of the upper respiratory tract infection, then of course if the clear drainage, you know it's viral, and supportive hydration, drink fluid, and take vitamin C, rest well, and take some over-the-counter medications to treat it. So this is a simple isolated rhinitis or viral-caused rhinitis. There are another kind of rhinitis. It's really tend to occur in older people, called a vasomotor caused nasal drainage associated with tears sometimes, particularly if the air changes temperature, either too cold or too warm, or taste some spicy food. or the food is too hot, too cold. That is usually occur in the older people. I think the management is pretty symptomatic. You can take some drops of the antihistamine or talk to a physician, see whether there's a better way to do it. And this is quite common and not quite serious. The serious condition in the nose, actually the nostril, it's the anatomic structure abnormality, either the enlarged conch or septum, or become the polyps. If that's the case, the irritation, the inflammation is always there. So if that's the case, you really need to seek the medical management, see a physician, and particularly if there's a polyps there. So the inflammation, the polyps not only cause the drainage of the fluid come out from the nose, and also sometimes may, on top of that, with the inflammation, infection, cause the drainage not clear. If the drainage is kind of thick and mucus-like, that's probably on top of that, there's the infection. If that's the case, regardless, I think get it checked. If you have persistent drainage around, not allergic, not seasonal, not vasomotor with irritations, but chronically drainage from your nose. So that's probably indicating either anatomic structure, either the enlarged septum or conch or the polyps. If that's the case, you really need to talk to your physician to get it checked and see whether there's some polyps. If there is polyp, then just remove it to treat the symptoms, also radical treatment. So this is about the rhinitis, part of the nose problem. The other serious nose problem, probably the cancer. It's really not common for the nostril or nasal cancer, but it could happen because lining with the squamous cells. The squamous cells, of course, also can all area of the squamous cells similar at skin, but it's just the mucus. So that's the cancer could occur in those cells, but it's not quite common. Sometimes the nasopharyngeal cancer probably start from the deeper and spread out. We do not know the exact origin, whether it's from nose or from the nasal or from the pharyngeal area. But anyway, so again, if that's the case, probably bleeding or drainage all the time. So if that's the case, you need to see your physician. Anyway, so this is about the rhinitis, and also nasal conditions could happen. On top of that, probably there's some genetic nose malformed. If that's the case, probably you know at the birth, and your physician already talked to you and follow up with you. So I'm going to stop here, and I hope it helps, particularly for those who had allergic rhinitis, prevent before the season. So I'm going to stop here, and thank you for watching. I'll see you next time.